Oklahoma's congressional Republicans all backed the Big Beautiful Bill. They promoted its tax provisions immediately, but many of its largest Medicaid consequences were placed on a slower fuse. The Congressional Budget Office now estimates nearly $915 billion less in federal Medicaid spending and 7.5 million more uninsured Americans. Oklahoma hospitals and families will live with those consequences. The hospital losses will not land only in rural Oklahoma or only in Tulsa and Oklahoma City. Using each district's share of Oklahomans covered by Medicaid, every congressional district faces more than $1 billion in estimated hospital reimbursement losses. District 2 has the largest share, but no House member represents a district that escapes the consequences. These are approximate district shares, not predictions for individual hospitals. Supporters may prefer the word reform, but the Congressional Budget Office used arithmetic. Federal Medicaid spending will be $914.6 billion lower than it would have been under the previous law. CBO also estimates 7.5 million more Americans will be uninsured. Federal payments to states will fall, hospitals and nursing facilities will receive less, and millions of people will lose coverage. Sooner Care is often discussed as though it were a small welfare program serving a distant group of unemployed adults. It is not. Sooner Care covered more than 1 million Oklahomans in June, about 1/4 of the state. Nearly half were children. Medicaid also supports hospitals, nursing homes, doctors, pharmacies, and emergency rooms used by people with every kind of insurance. Medicaid's role becomes especially clear in the delivery room. Sooner Care paid for 23,694 Oklahoma births in 2024, almost half of every baby born in the state. Pregnant women are generally exempt from the new work rule, but the hospitals where they deliver are not exempt from lower Medicaid payments. Medicaid is where promises about supporting families meet the hospital bill. Congress did not impose the new rules equally on every Sooner Care member. It selected about 257,000 low-income working-age adults within the program. Beginning in 2027, they face a new work and reporting requirement and eligibility reviews every 6 months instead of once a year. They are not in a separate program. They are the part of Sooner Care Congress placed behind a higher paperwork wall. CBO expects the extra 6-month review to remove some people who no longer qualify. But that is expected to be the minority of the coverage losses. CBO estimates that 70% of those losing coverage after the first additional review will lose it for procedural reasons: missed paperwork, communication problems, or difficulty navigating re-enrollment. A renewal system should ask whether someone still qualifies, not merely whether every step was completed before a deadline. The phrase work requirement does not tell the whole story. It is also a reporting requirement, an exemption verification requirement, and a data matching requirement. Workers with irregular hours, several employers, or self-employment may have records that do not fit neatly into a state database. Caregivers and people with chronic illness may have to prove an exemption. CBO estimates another 2.8 million people will lose Medicaid because the requirement adds application and verification steps. Checking eligibility twice a year and enforcing a new work reporting system will not happen for free. A Republican state senator estimated Oklahoma may need about $30 million a year in additional administrative spending. The state must modify computer systems, connect databases, verify exemptions, contact members, process documents, and hear appeals. That spending does not provide one additional doctor visit, prescription, or hospital treatment. Pays for the gate. Arkansas provides a real-world warning. Nearly 17,000 people were removed from Medicaid during the first months of its work and reporting experiment. Researchers found no significant increase in employment. More than 95% of the targeted population appeared already to work enough or qualify for an exemption. Lack of awareness and confusion about the reporting system were common. Arkansas removed insurance cards, but it did not produce a measurable increase in jobs. Georgia raises an equally important fiscal question. Through March 2025, Georgia spent $54.2 million administering its Medicaid work requirement program and about $26.1 million on medical assistance. In other words, It spent more than twice as much operating the eligibility gate as it spent providing health care to the people who got through it. Oklahoma should demand a public cost-benefit analysis before calling that model efficient. The paperwork provisions receive much of the political attention, but they are only part of the law. CBO estimates about $58 billion in deficit reduction from the extra eligibility reviews and about $317 billion from the work and reporting provision. Another $149.4 billion comes from limits on state-directed provider payments. Those reductions lower payments to hospitals, nursing facilities, and physicians. They are financing cuts. The Oklahoma Hospital Association estimates that the law will reduce Medicaid reimbursement to Oklahoma hospitals by more than $6.3 billion when fully phased in, including more than $850 million a year in supplemental payments. That is not automatically a check the legislature must write. It is revenue hospitals will no longer receive. The emergency room, the nurse, the medicine, and the premature baby do not disappear when the payment does. Oklahoma Republicans did not use the same sales pitch. Tom Cole said Medicaid was not being cut. Kevin Hern invoked no cuts and said Congress would pursue waste, fraud, and abuse. James Lankford said people would transition into employer insurance. Josh Burchine said the change would restore the dignity of work. Lucas and Bice emphasized other parts of the bill. CBO now estimates lower federal spending, procedural coverage losses, lower provider payments, and millions more uninsured. The medical need does not disappear when an insurance card is canceled or a hospital receives less. If Republicans truly believe this law merely removed fraud and moved people into jobs and employer insurance, why does CBO estimate that most people losing coverage under the work reporting provision will become uninsured, that eligible people will lose coverage over paperwork, and that hospitals and nursing facilities will receive lower payments? Read the full article, District Estimates and Sources on Substack.